Low testosterone in men. Introduction. Which of the following glands help produce and control the release of testosterone? Choose one of the following options. 1. Adrenal. 2. Hypothalamus. 3. Pituitary. 4. Testes. 5. All of the above. Correct.
Females do not produce testosterone.
Select true or false.
Correct. In females, the ovaries make small amounts of testosterone. However, too much testosterone in females causes male characteristics such as facial hair. All forms of erectile dysfunction, or impotence, are caused by low testosterone.
Select true or false.
Correct. Low testosterone can cause erectile dysfunction. However, diseases of the nerves and blood vessels can also affect the penis and cause erectile dysfunction. As men get older, decreased sex drive is common.
Select true or false.
Correct. Younger men never have low testosterone.
Select true or false.
Correct. Many diseases can cause low testosterone in younger men. This includes cancer of the pituitary and hypothalamus, inflammation of the testes, cancer of the testes, and genetic diseases. All the testosterone in the body circulates freely in the bloodstream.
Select true or false.
Correct. Not all the testosterone in the body is available to tissues for action. About 40% is bound tightly to a protein and is not available for action. About 58% is bound to albumin and is available to most tissues. The remaining 2% circulates freely in the blood. That is why blood tests were devised to measure free and total testosterone. All patients who have low testosterone can benefit from hormone replacement therapy.
Select true or false.
Correct. Some men cannot benefit from hormone replacement. For example, men who may have breast or prostate cancer should not receive testosterone replacement therapy.
Thank you for using Explain.